Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Good morning, Nita. Or is it afternoon or evening? I never know.
We never know. It's just like we're in a dark studio, and it is what it is. So how are you today?
I'm living it up. What do you think?
I think I'm great, and you're living it up. So this is a good combination to present to our listeners because we want everybody to feel better who's in musculoskeletal pain. And you're going to get better right here, right now, because we have for you already a free book today. When you phone the show at 866-870-5752, you get Dr. Darrow's latest book. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. So do call. At least get your free book and call early in the program because we have a long queue sometimes. So we want to get to everybody. Again, it's 866-870-5752. Would you like to talk to Gary?
Gary, of course. How are you, Gary? Dr. Marc Darrow.
Hello?
Hello.
Hello?
Are you living it up, Gary?
I'm doing fine. My wife's got the problem.
Oh.
Has she got the hip problem?
Oh, yeah.
You know what I'm going to do, Gary? I want you to hang with us because it's the beginning of the show. There is someone named Dave, actually, who I want to take first. You're going to talk about the hip, but first I want to go to Dave to talk about TMJ because it's such a common problem and people don't really realize what it is. So, Dave, do you want to talk about an issue with TMJ?
Hi, I would absolutely love to. Well, one of the things about TMJ that's so sort of sinister, if you will, is most people that have it aren't really aware that they have it. They're more aware of their tension headaches. They're more aware of their migraines or ear pain or facial pain.
Right.
But they don't know that it could be the TMJ that's causing it all.
That's true. And actually, there are people that have TMJ that can attribute all kinds of things like chronic fatigue syndrome, fibromyalgia, neck pain, back pain, and all kinds of things because of it. And sometimes it could be a whole myriad of things coming from the back of the neck, too. Those are all things that I treat. What kind of work do you do, Dave?
Hi, so I'm a dentist and an acupuncturist, and I help people get relief from it.
Okay.
So
and what do you do
they're
for
clenching this? Predominantly, I make oral appliances.
Okay.
And I use lasers and I do acupuncture to get them to kind of break the pattern of their clenching and to just set the jaw in the right spot.
Wait a second. Your name is not Dave Shirazi, is it?
Yes, it is. It's so funny.
Well, you're very famous in this area. Yeah. Why don't you give out your phone number to people? Give out your number so people can call you if they want to.
I'd be delighted. So we have two offices, one in Brentwood, one in Thousand Oaks. And the Brentwood office is 310-401-0813.
Mm-hmm.
And our Thousand Oaks office is 805-496-5700. But if no one had a pen and paper, the easiest way to remember it is our website is tmjla.com.
I'm going to write it down, tmjla.com. Okay, very, very cool. Yeah. And I love that you're eclectic in terms of you're actually a dentist, but you do acupuncture, so you're into what a lot of people call alternative medicine too. And that's really the way I think every doctor should be, if you want to use the word should. We have to be open-minded and be open to all kinds of things, not just take the point of view we believe in, because we're here to make patients happy. And some people don't even want traditional medicine. I know that a lot of doctors do surgery on TMJ joints and really screw people up. And part of, I don't know, Dave, if you know all about what I do. You probably, since you're calling and you know some of my work, we use stem cells and platelets to actually heal TMJ. And I don't ever put a needle into joints, just to let you know, because that can actually destroy the meniscus that's in the joint, which is a cushion, like a disc in the back or something like that. We have labral tears that people get in hips and shoulders, and meniscal tears in knees we take care of. But we also do TMJ. I never put a needle into that joint. I actually put it into the joint capsule and the surrounding ligaments around there. Do you actually inject the TMJ joint?
No, I do. Mostly I do the posterior band that's behind the joint.
Okay, very good. We'll have to get together. You have to show me your technique. I'll show you my technique. I get amazing results.
I'd be delighted.
Amazing results using stem cells and platelets for TMJ. I cannot remember one patient that's failed with it. I'm sure there must be somewhere, but patients usually come back after a couple weeks and are pretty amazed at the success they have. Well, God bless you, Dave. I appreciate your call. We're going to go to Gary now. And Gary, your wife is talking about hip pain, I take it. Is that correct?
Yes. She's
Okay.
got a bad hip. In fact, they've scheduled her for surgery, and I'm trying to talk her out of it.
How old is your wife, Gary?
Huh?
How old is
71.
she? 71. Okay, she's young. Can she walk around? Can she move her leg?
Yes.
Okay. And she just has some pain. Does she have decreased range of motion of the hip joint?
She's got motion. Because of the pain, she's not moving as well as she should.
Sure.
The pain is relatively new, I'd say within a year.
Oh, okay. That's good news also. I get tons of people that have hip arthritis. Does she have hip arthritis? Did she have an X-ray?
Yes, she does. In fact, that's what I was going to tell you. I thought she's had an appointment with a surgeon already, and and scheduled a surgery. I'm trying to talk her out of it.
Okay. Well, I think, the most important thing in medicine is to get several opinions, but don't go to the same type of doctor because you'll get the same opinion. So I was trained in orthopedics, and I did a lot of surgery in my training. And then I don't know if you know my story. Your line is not clear. I don't know if you're on a speaker or whatever, but let me hear me out for a second, please, Gary. So I had a shoulder surgery when I was a young guy in medical school, and my boss, my professor, did it for me, and I loved the guy, but it came out bad. And that taught me the lesson that surgery may not be the very best thing. And in my experience now, I've been doing regenerative medicine with stem cells and platelets now for almost 25 years. And there's very, very few people that I ever have to send to a surgeon other than for a second opinion. And the reason I do that is what's called informed consent. Informed consent means that the patient needs to know all the possibilities, and then they get to choose what they want to do. Some people want to have surgery even after I tell them they don't need it. And that's fine with me. If they want to do that, that's their right. They own their body. I don't own their body. But a lot of times I send people to an orthopedic surgeon, even after I tell the patient that we can probably get them better range of motion of a joint, or decreased pain, tendons, ligaments, joints. I treat really everywhere from the top of the head all the way down to the bottom of the feet and everything in between, because all I'm doing really is generating more tissue growth. We stimulate the body to grow back the tissue and rejuvenate itself. So the body is really healing itself. It's a natural way of healing. I don't cut tissue out. And I find that way too often people get these surgeries where they're told they're going to get better and then they come out worse. And I'm one of them. And that's why I chose this other path of what's called regenerative medicine. We regenerate the body. So if I were you, well, actually, if I were your wife, I should say, I would come in to see someone like me or me and see if there's an alternative to getting cut, because the problem with hip replacements is they wear out. That's one of the problems. Unfortunately, in Denver, when I was doing my internship in orthopedic surgery, there was a woman who was getting a hip replacement who died on the table. And I've seen these things happen. I'm not wanting to implant you with negativity because a lot of people want to get that surgery. I'm just telling you the truth. I had a patient who had a knee replacement. He died 2 weeks later from a blood clot to his brain. So surgery, although it sounds great, in my experience, it's not the right thing to do. In most cases, there are cases where it does have to be done. You break a bone, it's sticking out of your leg, you better get right to the surgeon. I would say run to the surgeon, but you can't. Nita, you're not laughing. You better laugh.
I'm laughing.
Okay, on the inside.
Yes.
So, my point of view is if you're not in an emergency situation, give regenerative medicine a choice. Give stem cells and platelets a choice. The platelets are something that we call PRP, platelet-rich plasma. If you hear that term PRP, then you know what we're talking about there. They're easy procedures. You walk in the office and you get injections and you walk out. You drive yourself home. You don't need people to drive you. It's really simple. It's really easy. It's non-invasive. Surgery is invasive. There's a lot of side effects for it. So that's pretty much what I have to tell you about your wife, Gary. Do you have any more questions about it?
Gary, are you there?
Well, I'm going to finish up.
Gary?
So, yes.
Go ahead, Gary. Do you have any other questions?
Yes, I was just going to ask. She's got a lot of calcification around it. I've seen the X-rays, and
yeah.
The doctor, of course, came straight out and said, "Oh, you need a hip replacement." And I'm telling her, "Please, let's take and go down and have you take a look at her."
Right. So here, let me tell you a couple of things about that. Calcification in the hip or any other joint is not generally a big deal unless you can't move it at all. I get people all the time that have terrible looking x-rays or MRIs where it looks like they can't even move, but they don't really have that much of a problem. Some don't even have very much pain. And I think that's the case with your wife. So I'm not really concerned that she's got arthritis. That doesn't really bother me in terms of the healing. There's a good chance that we can heal her up based on the fact that she's somewhat active.
Well, I'm going to discuss it with her again today. I just wanted to touch base with you before.
Yeah, and if you want to email me through the website, which is www.lastemcells.com. That's www.lastemcells.com. There's a place to put your phone number. I'll actually call you today and talk to your wife and give her the information directly, and she can ask me questions about it.
That would be fabulous.
I would love it, yeah. I like close contact with people. I'm a communicator, and every one of my patients gets my cell phone number. You will have it by the time I call you, because I'm going to call my cell number to you, and we'll get this thing moving. At least your wife will get more information. I'm not going to tell her what to do. That's up to her. But I'll give her the information and the options.
I can take her and drag her down, but it's like a horse. You can take it to water.
This sounds funny, but many of the patients that come to me every day are being dragged by their spouse or their boyfriend or girlfriend. And
when I get off the line, I'll definitely shoot you the email.
Yeah.
And
well, that's great. And again, for other people, the website is www.lastemcells.com, and there's a spot on every page to email me. I get back to every person every day, okay? And if anybody wants to call the office to get more information than what we didn't talk about on the radio, the number to the office is 800-300-9300. That's 800-300-9300. There's usually people by the phones. If the phones are busy, just leave your name and phone, and we'll get back to you quickly. Okay?
Okay, real good.
God bless you. Hey, Gary, how about you? Do you have any... he's off. Oops, he's somebody offed him.
Sorry, it was me. We appreciate your call, and if you're having any pain, Gary, you call us right back at 866-870-5752. And that number is for all the rest of you that are sort of
Let me do this, Nita, because you're chomping at the bit today. So I'm going to give out a copy of my free book.
Yes.
It's a $25 book, but I'm going to give it out for free if anybody wants to call in today. It's got 256 studies in it, actual scientific studies that are all about why surgery may not be the best thing for you and why regenerative medicine using your stem cells and platelets may be the best thing for you. I never force anybody to do any treatment. I'm an educator. People always come in, patients come in, they go, "What should I do, doc?" And I go, "You decide. I'll spend as much time as you want educating you about the different options, but it's always going to be your decision. I don't get in the way of other people's lives and what they should do. I have enough trouble figuring out what I should do." Anyway, you get a free copy of my book. I'm holding up to the video camera right now, Stem Cell and Platelet Therapy. Regenerate, don't operate. So the thrust of this is pretty obvious. We have an opportunity to regenerate the body and rejuvenate it. Why are we going to cut tissue out? That makes no sense to me. And a lot of surgeons now are actually using stem cells and platelets intraoperatively. So they're opening up the body, cutting out tissue, and then they're spraying stem cells or platelets in there. They don't need to do that. They can do it with a needle without opening up the body and without cutting tissue out and doing the healing that way. And there are more and more orthopedic surgeons that are starting to do this. Personally, I wouldn't go to an orthopedic surgeon to get regenerative medicine because they don't really believe in it. This often takes several treatments. By the way, I'm going to give out the phone number. You get a free copy of my book, Regenerate, Don't Operate, Stem Cell and Platelet Therapy. Give me a call right now. A free copy of the book will get sent to you for free. The phone number to the studio, you can talk to me live, 866-870-5752. I'll repeat it, 866-870-5752. If you want to reach me at the office, call me at 800-300-9300.
So what else are you doing in the office these days?
Well, a couple of things that are pretty amazing. We do what's called the vampire facelift. That means a non-surgical facelift that's done with your own platelets from your blood or stem cells. And we inject those into the face, numb up the face, and do the injections. And it always amazes me because you'd think it's something that only females would want to do, but we have just as many males do it as females. Same thing with hair regeneration. We can put these same cells from your body into your scalp and regrow your hair. Okay, it's not going to work on somebody who doesn't have any. All right, so I'm putting that out there. This is not some kind of miracle. These treatments aren't miracles. They just make sense. You stimulate the body to produce more tissue, more collagen in the face. The face actually grows more collagen, and you look younger like you were. And the hair regeneration is the same thing. It wakes up the follicles that are there. If you're completely bald, don't come see us. It's not going to work. So I'm going to go to Jeff from Simi Valley. Jeff, Dr. Marc Darrow, is this your knee that you're calling about or someone else's?
Jeff, are you with us? Hi, Jeff.
Hello, Jeff.
Jeff, push the button that turns your phone back on.
All right, we're going to keep Jeff. We're not going to get rid of him, Nita.
Okay. Well,
because
hold on.
who knows? He may pop.
He'll show up.
He may show back up.
Okay.
In the meantime, I'm going to go to Fariba in Agoura Hills, and she's got some wrist issues. Fariba, Dr. Marc Darrow, how are you today?
I'm good. How about you?
I'm living it up. How long has your wrist bothered you for?
It's been about 3 years, and I went to many doctors. I had many shots, and one of my wrists actually has carpal tunnel. It gets numb mostly at bedtime and when I wake up.
Yep.
And the other one, which is my left one, doctors told me that I have arthritis.
Okay.
Which is really painful, and it's always with me.
Okay. So you said you had a lot of shots in your right wrist. Were they were they steroid shots into the carpal tunnel or into the joints or the ligaments, or don't you know?
Well, actually, the shot was done on my left one, which I have an arthritis.
Okay.
Not on the carpal tunnel one.
Okay. Was anything done for the carpal tunnel?
No.
Okay. So let me talk about the arthritis first. Putting a steroid into an arthritic joint is probably the worst thing you can do for it, because the cartilage is worn down to begin with. That's what arthritis is generally. And then when you put a steroid in it, it kills the rest of the cartilage. And I'm not making this up. You can go to, I always tell people, go to Google. And in this
No,
case,
I know that because since they did it, it got worse.
Okay. But let me tell everybody else about this, okay? Hang on just a second, Fariba.
Sure.
When you Google, let's say, cortisone, that's a steroid, and then put cartilage next to it, those two words. So you're going to put in steroid or you're going to put in cortisone, and then you're going to put in cartilage. You're going to come up with a lot of studies that show that the cartilage gets destroyed, okay? I'm not making this up. This is real. So it's not a good thing to do. It's traditional medicine. I know that. It's what doctors do, but it's something that I don't like people to do because I don't want to injure people. I want to regrow the tissue. The way you regrow the tissue in arthritic joints is you put your own cells back in there from your blood or from your bone marrow. You take the stem cells or the platelets or both, and you inject it. Use a little teeny needle in the wrist or in the finger joints, whatever that is. You can do it anywhere in the body, in the knees, the neck, the back, the hips, the toes, the ankles, shoulders, anywhere in the body you can do this. I do it all over the body. I do muscle tears, ligament tears, you name it. Tendinitis, tendinosis. There's really no...
Can I ask you a question?
Go for it.
I heard that a stem cell works only for 6 months, not more than that. I talked to so many doctors.
Sure.
And I heard about that. I Googled it.
Okay.
So what do you think?
I think it's a lie. It's not that I think it's a lie. I know it's a lie. How long does new tissue last? Does new tissue last 6 months? No.
No.
Okay. So the people that are telling you that are not people doing this work. Do you understand that? It's like if I am not doing surgery, but I'm telling you about surgery, am I going to be right or wrong? I'm going to be wrong because that's not what I'm doing. So don't listen to guys that aren't doing the work. They don't know a thing. If you want to find out...
Well, actually, not only the orthopedics, but the other doctors even told me.
Well, I don't know what the other are. They're not regenerative medicine doctors. I know. I get it. I know the orthopods say that, and I'm friends with a lot of orthopods who say it doesn't work at all. Well, that's because they don't do it. Or they might try it once, and that's not how this works. This is like, in a very crude way of responding to it. If you have a hole in your backyard and you got to fill it with dirt, how many shovelfuls does it take? 1 or 20? I don't know the answer. It depends. Everybody is different.
Okay.
So when people ask me, new patients come in every day and they go, how soon will I heal? I go, I don't know. They go, how many treatments will I need? I go, I don't know. Everybody is different. I've injected myself. Go ahead, Fariba.
I have another question. I'm sorry, I interrupt you. Is it going to be the same wrist that I had before? Am I going to have it the same strength that I had it before?
You mean same as a steroid shot? As cortisone? No, it's a different experience.
No. I mean, before it got on.
Oh, you mean, are you going to be perfect like a 15-year-old girl again? Is that your question?
Yes.
I don't know.
Yes. Not
I don't
15,
know.
Not at least like 40. I'm around
I don't know.
50 right now.
I don't know. I don't know what you're going to be. That's what I'm trying to put out here. Can it be? Yes.
So,
there are people all the time who get complete healings. And there's people that don't listen to me that get incomplete healings. So I don't know what kind of patient you're going to be.
I see. And how much is that? How many times I have to come for it?
I don't know. That's what I just said. I don't have the answer on healing. If you want to stick with us, come on back. We're at 866-870-5752. The website is www.lastemcells.com. You can email me from there. I'll get back to you today. Hang with us, everybody. We're going to the break.
Stay with us, Veripa. We'll be right back. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Stay with us.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.